H1 Antihistamines. Mechanism, uses, and adverse effects. The drowsy allergy patient. A 28-year-old man develops severe sneezing, itching, and watery eyes after exposure to dust. He takes an antihistamine and his symptoms rapidly improve. But soon he becomes extremely drowsy. The next day, a different antihistamine controls the same symptoms without making him sleepy. Both block H1 receptors. So why does one cause sedation while the other does not? The answer lies in the pharmacology of H1 antihistamines. Mechanism of action. H1 antihistamines act as inverse agonists at H1 receptors, stabilizing the receptor in its inactive state. How they reduce allergy symptoms. First, they block H1 activation, preventing the effects of histamine released during an allergic reaction. This reduces vasodilation, capillary permeability, and sensory nerve stimulation. As a result, typical allergic manifestations such as edema, erythema, and itching are relieved. First-generation agents also cross the blood-brain barrier, producing CNS effects including sedation via central H1 receptors and anticholinergic activity. Adverse effects. The adverse effects of H1 antihistamines are particularly important with first-generation agents. The most prominent is sedation. Because these drugs cross the blood-brain barrier, they can cause drowsiness, impaired coordination, and cognitive decline. This is why patients should be cautioned about driving or operating machinery. Many first-generation drugs also produce anticholinergic effects, resulting in dry mouth, blurred vision, urinary retention, and constipation. Finally, some H1 antihistamines also produce alpha-adrenergic blockade, which can cause dizziness and orthostatic hypotension, particularly in susceptible patients. Clinical uses. Allergic conditions. H1 antihistamines are first-line agents for many allergic conditions mediated by mast cell histamine release. In allergic rhinitis or hay fever, they reduce symptoms such as sneezing and rhinorrhea, although their effect on nasal congestion is relatively limited. They are also useful in allergic conjunctivitis, where they relieve itchy, watery, and red eyes. Another important indication is urticaria or hives, where H1 blockade reduces the characteristic raised itchy welts on the skin. Clinical uses. Motion sickness and vertigo. Drugs such as dimenhydrinate and meclizine act within the central nervous system and block histaminergic signals from the vestibular nucleus to the vomiting center. By suppressing this vestibular input, they reduce the nausea and vomiting associated with motion sickness and certain forms of vertigo. Thus, unlike their role in allergy, this clinical use depends largely on the central actions of first-generation antihistamines. Additional clinical uses. In the common cold, they provide symptomatic relief by reducing rhinorrhea and sneezing, particularly with first-generation agents. In anaphylaxis, antihistamines are only adjuncts. They may relieve itching and hives, but they do not adequately treat life-threatening airway obstruction or hypotension. Adrenaline remains the drug of choice. Finally, the sedative property of first-generation antihistamines such as diphenhydramine is sometimes used for insomnia, including in some over-the-counter sleep aids. First versus second generation. Key differences. First-generation drugs cross the blood-brain barrier, producing high sedation and significant anticholinergic effects such as dry mouth and urinary retention. Examples include diphenhydramine and dimenhydrinate. In contrast, second-generation drugs have much less CNS penetration and therefore cause minimal or no sedation and fewer anticholinergic effects. Examples include cetirizine, loratadine, and fexofenadine. This makes second-generation antihistamines generally better tolerated for daytime treatment of allergic conditions. Key takeaways. To summarize, remember three key points about H1 antihistamines. First, they are inverse agonists, stabilizing H1 receptors in their inactive state and thereby reducing histamine-mediated effects. Second, blood-brain barrier penetration determines sedation. First-generation agents cross the BBB and are more sedating, whereas second-generation agents have much less CNS penetration. Third, H1 antihistamines have broad clinical utility, including allergies, motion sickness, cold symptoms, use as an adjunct in anaphylaxis, and insomnia.